Good evening, everyone. Welcome to Unacademy, where you can crack all NEET PG exams with us, with our top educators, quality content, and have a great learning experience. A little about me. I'm Dr. Sasha Menon Remedius. I've done my MBBS from Father Muller Medical College, Mangalore, my MD in anesthesia from Father Muller Medical College, Mangalore. I have 2 publications and 1 paper presentation of anesthesia, and I have been working and teaching in Bangalore for the past 2.5 years. So today we're going to have a mega quiz. That is all the topics whatever have been taught. We find a quiz. A little about Unacademy. It's one of India's largest online learning platform where you can get plus subscription and access to unlimited live and recorded courses from India's top educators. So guys, hurry and get your subscriptions. What will you get out of Unacademy? So basically we have our daily live classes. So Unacademy is where you can chat with your educator, engage in discussions, clear your doubts. So what happens when you go to a coaching institute? You have to get up, get ready, reach the coaching institute, then you have to get appropriate place. Your educator should be have enough time to clear everyone's doubts. It's difficult, the educator's flow gets disturbed. He or she might not be able to clear everyone's doubts. So there's a lot of plus or minus things happen. Right? Whereas at Unacademy, during the class itself, you can clear your doubts and answer polls and chat with your educator, right? So the educator either during or after class will clear your doubts. Now these are all structured courses and they are all in line with your exam syllabus to help you best prepare for it. So these are all live tests. We conduct live tests. The educators basically have, based on whatever is required for you all from NEET PG point of view. So based on that, the educators have prepared the course structures and so that it's best in your interest. Then live tests and quizzes. So these will help you evaluate. These live tests and quizzes will help you to evaluate your preparation on a regular basis, and you can get a detailed analysis on your performance basically. Then we have unlimited access. So one subscription can get you access to all our live and recorded courses, and so wherever you are sitting, whatever you may be doing, you can watch from the comfort of any of your devices. Now coming back to the top educators, Dr. Nikita Nanwani, Dr. Mohammed Azam, Dr. Preeti Sharma, Dr. Divesh Mishra. These are all our top educators on the platform. And Dr. Nikita Nanwani, she's a NEET PG mentor for radiology as well as mnemonics and concept, focusing on mass note topics which encompass a lot of subjects. So mnemonics is a very interesting part of studying. So for those of you who it works, it's really good. Sec guys. So for those of you who it works, it's a really good deal, I would say. But it doesn't work for everyone. It didn't always work for me, mnemonics. But though, like I said, for those of you who mnemonics works, it's really good because you will learn a lot. Then, like I said, Dr. Mohammed Azam, Dr. Preeti Sharma, Dr. Divesh Mishra are our other top educators. Now, as you can see on the screen, there are about 19 subjects that you all will have to study before you all can clear this exam. I know it's not. I know it is tough. It's not as it is quite a big to be able to crack such an exam, but it's something that you will need to do, and you will have to do, but not impossible. And we are here to help you all do that. Subjects like anesthesia, psychiatry, radiology, dermatology all have been 100 marks. Have been allotted around 11 marks. Right now, these 11 marks. Basically, these 11 marks. Now, how would I put it? These 11 marks, I would say they are easy to crack. So these subjects you all didn't have to take during your MBBS. Even here, it's not that you'll have to go into much detail. Those 11 marks are easy to get, but without reading the material, without going through some practice papers, without doing some practice papers, you won't be able to, because they will go into some detail, if not that much detail, but it's not easy to without doing some amount of studying. Whereas your physiology, anatomy and all that are a lot of 44 marks. You all will have to go in detail into these subjects. You all anyways have spent 1 year studying these subjects, so they can ask you anything from anywhere when it comes to these subjects. Then these are some of the ongoing courses on our platform. As you can see, course on neurophysiology, GI surgery, cardiovascular thoracic surgery, post capsule on the larynx, pathology on pathology, respiratory system, etc. So these are the subscriptions on your screen. As you can see, there are 5 types of subscriptions. Those of you who are giving NEET, yeah, I think the 6 month subscription should suffice. For the rest of you, I would recommend uh, uh, 12 and 24-month subscriptions. So your 12 and 24-month subscription basically um, so like I said, these are good uh, this is a good platform. And so 12 months and 24 months, these are important subscriptions. So it gives you time to prepare and you'll get a better idea. So when spending those that 1 year or so will actually help you all prepare better, and it will be more beneficial to you all, right? So then coming to uh, the also the 12, they are more economical from the point of view that it's a one-time subscription. So suppose after 6 months, if you're not able to clear the exam, or suppose you're not able to clear the exam after, say about uh, and it's difficult for you to clear the exam, but somehow you need to, like, you don't know, like, it has to be done. So from that point of view, uh, this gives you a buffer period. This 12 and 24-month is a buffer period, so you have that time to, you don't have to pay again after 6 months. You'll have to pay again, right? In this if uh, that would be your 12 and 24 months. And also this 12, this time actually, this period actually gives you time to think about the subject that you like, the subject that you want to take. Maybe you like it, maybe you don't like it. So it actually gives you time to think about what you want and what you don't want. Now, so as you can see, you can use code at the bottom of the screen. Say SHA, avail your 10% discount. Even over your 24 months, nobody will ask you how long you took your NEET, why you took it. Nobody will ask questions. You can use my code SASHA to avail your 10% discount. As you can see, the discounts are applicable on all your types of subscription. Now we'll begin with the quiz. I will be giving you all 1 minute per question. So take your time and answer. After that, we will discuss each question separately. Okay, guys, I hope you all are ready. We shall begin our quiz now. This is the first question. A patient treated with a king laryngeal tube placement experiences which complication almost 40% of the time? So most of the time, the king laryngeal tube in patients with major local pathology, the pharynx and larynx, such as any tumor or edema, etc. So patients with trismus facial or upper airway trauma, trismus facial or upper airway trauma, morbidly obese, pregnant, or patients with reduced lung compliance, and increased work of breathing, and patients with increased work of breathing, because basically the resistance will increase work of breathing, like patients with pulmonary fibrosis status, asthmatitis, etc. So the LMA basically in these patients with restrictive disease forms a low pressure seal around the forms a low pressure seal, and this can actually and hence forms a low pressure seal around the laryngeal entlet, and ventilating the patients with these conditions may require higher ventilation pressure, so ventilation may be inadequate. Now, some supraglottic airways include which of the following features to help decrease the chances of aspiration? So, some supraglottic airway so basically a gastric suctioning channel. So the airway devices have these, so the integrated bite block, which will prevent blocking when biting. Then it has a rigid proximal cuff, dual pilot balloons for when there is a dual cuff, so a rigid proximal cuff, and a gastric suctioning channel. So there will be a gastric suctioning channel too to suction out all the secretion. So what happens with all these are all modifications in the LMA. So basically the second generation LMAs have these features. So your ProSeal LMA, your LMA Supreme, all the second generation LMAs will have this feature of this suction tube, etc., that can be passed, right? So to help decrease the chance of aspiration, this gastric suctioning channel will be inserted into the airway so that a suction tube can be passed and gastric content can be aspirated. Your patient presents unconscious and breathing at 6 times per minute and shallow. Should So your patient presents unconscious and breathing 6 breaths per minute and shallow. So what would you do? Ventilate the patient with a bag mask device, administer oxygen, determine the patient's blood pressure, or transport the patient to an emergency department. So basically, the patient is unconscious, breathing at 6 times per minute. In this situation, you can ventilate the patient with a bag mask device. So when you're ventilating with the bag mask device, you will obviously administer oxygen, post that the vitals of the patient can be determined, and if needed, the patient can be intubated, and the emergency department should be informed, and the patient can be transported to an emergency department. So your patient presents unconscious with snoring respirations at 4 per minute. You should so your patient presents unconscious with the snoring respirations at 4 liter per minute. You should, what would it be? Administer oxygen via non-breathing mask, insert a oropharyngeal airway, ventilate the patient with a bag mask device, or determine the patient's heart rate. So I would say insert an oropharyngeal airway. So over here, uh, the patient is unconscious, snoring. So insert the airway, prevent backfall of the tongue to prevent the snoring. Snoring is occurring because the airway is collapsing. Once you have inserted the airway, you can administer oxygen via a non-rebreather mask via the patient is unconscious, so you cannot do via a non-rebreather mask because patient will not. It's not a conscious effort, so you can post insertion of the airway. You can ventilate the patient with a bag mask device. Now, what is the approximate maximum FiO2 of a nasal cannula at 2 liter per minute? So your answer would be 29. So the basic rule is, so room room air FiO2 is 21%. So for every liter, so every 1 liter is plus 2. Okay, FiO2 is plus 2 FiO2, right? So every 1 liter of oxygen plus 2 of FiO2. So at 21% is room air. So this is plus 1 liter oxygen per minute. So plus 2 plus 2. I'm sorry, it's plus 4, my bad. So plus 4 plus 4, not 2, I'm sorry, it's plus 4. So every liter of oxygen, the FiO2 is plus 4. So over here, 2 liter is being given. So 21 plus 4 plus 4, that is around 28 to 29 will be the FiO2 approximately. So patient is on a 40% air entrainment mask setup and the doctor orders 65% FiO2. What are you going to do? So patient is on a 40% entrainment mask setup and doctor has ordered a 65% FiO2. So what you going to do is basically um, put the patient on a non-rebreathing mask. So the non-rebreathing mask, I'm sorry, put the patient on a nebulizer mask. So this non-breathing mask and partial breathing mask, they are variable devices. Okay, but and the doctor has ordered specifically 60%. So this would be a fixed device, oxygen delivery device. So the nebulizer mask can deliver around 90% of FiO2. The doctor has ordered strictly 65%. The patient can be put onto this nebulizer mask since it is a fixed device. Even though the non-rebreathing mask also delivers around 90% FiO2, these are variable devices. Which drug is administered to reduce pain on injection with propofol? So, which drug is administered to reduce pain on injection is lignocaine. It is a local anesthetic. Okay. If it is ideally, it should be given about 90 seconds before propofol is administered for ideal results. But if it is given along with propofol, it is given in the concentration in a 10 cc syringe. In a 10 cc syringe, it is given as 1 ml lignocaine and 9 ml of propofol. All are true about the mechanism of action of propofol except so your answer would be NMDA stimulation, right? So it causes GABA potentiation, it depresses spinal cord activity, it increases dopamine concentration in the nucleus accumbens, it gives a feeling of satisfaction or well-being. So it gives a feeling of satisfaction, well-being, it depresses the spinal cord activity. It does not cause NMDA stimulation, right? NMDA stimulation is it cannot cause stimulation, right? It has again NMDA. It does not inhibit or stimulate. Right? It has no action on the NMDA receptor. It basically acts on the GABA receptors. It is. It is not an antidiuretic. It is a anticonvulsant by acting on GABA receptors. Then it is an antioxidant, yes, and antipruritic by its action on spinal cord. Absolute contraindication of propofol are all except. So patients with the known hypersensitivity, absolute contraindications to propofol are all except hepatic impairment. So absolute contraindications are the patient with the known hypersensitivity to it, yes, allergy to egg and soya as it contains egg lecithin and soya, and disorders of fat metabolism also. So CNS effect of propofol is all except so are all except CNS effects of propofol are all except. So it is in ICP. I mean, are all, I'm sorry, all are false except, yeah, so except these three are all false. So it causes a decrease in the cerebral metabolic rate of oxygen. It does not cause excitation. It causes depression of the cerebral cortex. Then it causes a decrease in ICP, correct decrease in CMRO2, and it causes a decrease in cerebral blood flow. So because in the decrease in cerebral blood flow, decrease excitation of cerebral cortex, decrease in CMRO2, there is decrease in the ICP also. Right? So it is cerebral protective, and it is used, it is protective even in seizures. It can be given in seizures. All the following are true except with regard to position. So the entire body is close to the level of the heart. Hemodynamic reserve is best maintained. This is true because compensating mechanisms are blunted by anesthesia. However, few degrees of head down Trendelenburg or head up reverse Trendelenburg are sufficient to cause sufficient cardiovascular changes. Yes. So head low is Trendelenburg and head up is reverse Trendelenburg. In a spine patient, one or both arms may be abducted out to the side or tucked alongside the body. Yes, it is recommended that the abduction of the arms, the side may be limited to less than 90 degree. It has to be limited to less than 90 degree to prevent injury to brachial plexus. Now all the following are false except so all the following are false except tilting a patient supine head down the reverse Trendelenburg position is often this is wrong. Head head up is reverse Trendelenburg. Trendelenburg position and reverse Trendelenburg shoulder braces should not be used because this can cause injury to the brachial plexus. In the head down position, decreases central venous, intracranial, and intraocular pressure. This is wrong. It actually increases because of increased venous return. So it increases the central venous, intracranial, and intraocular pressures. The prolonged head down position can lead to swelling of the face, conjunctiva, larynx, and tongue with an increased potential for post-operative upper airway obstruction. This is true. So the head down position, increased venous return can lead to swelling of the face, the conjunctiva, larynx, tongue, and increased potential for post-operative upper airway obstruction. All the following are true about Trendelenburg position except Okay. Yeah, so the cephalic movement of abdominal viscera against the diaphragm increases the functional residual capacity and pulmonary compliance. So this is actually wrong. It decreases. Okay, so the cephalic movement when the abdominal viscera when it presses against the diaphragm, it decreases the FRC and the pulmonary compliance. Mechanically ventilated patients, airway pressures must be higher to ensure adequate ventilation. Um, In the Trendelenburg position, the stomach lies above the glottis. Endotracheal intubation is preferred to protect the airway from pulmonary aspiration. Because of the risk of edema to the trachea and mucosa surrounding the airway during surgeries, in which patients are in this position, it is prudent to verify an air leak. So basically, how do you verify the air leak is, so around the usually the endotracheal cuff will be inflated and there will be no leak, right? So when you deflate the cuff, if there is no airway edema, there should be some leak. So when the stethoscope is placed over the neck, you can hear a whooshing sound because of the leak. Now what we do is, now suppose the leak is removed, right? So now the leak is now you've deflated the cuff, but there is edema. So the edema is, it doesn't prevent the air. So it forms like a cuff over the tube. It presses against the tube, the airway edema after deflating the cuff. So when you keep the stethoscope on the neck, there will be no whooshing sound. So that is why in these patients who are kept in this position for very long because of the increased venous return, there will be congestion of the mucosa and it can lead to airway edema. So it is better to verify an air leak around the endotracheal tube in such patients or to visualize the larynx before extubation. Oh, I'm sorry. By mistake, my bad. Yeah, sorry. By mistake. Yeah. So reverse trend in position, all are true except the head up tilt, often employed to facilitate upper abdominal surgery by shifting the abdominal contents chorda. The position is increasingly popular because of the growing number of laparoscopic surgeries. There is decreased venous return because there is cooling actually occurring. The position of head above the heart actually reduces the perfusion pressure to the brain, and this should be taken in consideration when determining the optimal blood pressure. The following are complications associated with the supine position, except Following are complications associated with supine position, uh, except there can be pressure alopecia because of if the patient is lying constantly on one particular area, there can be ischemia and pressure alopecia. Then in the supine position, the normal lordotic curvature of the back is lost, so it can lead to backache. Then the tissue overlying bony prominences must be padded to prevent any nerve injuries. And the most common peripheral nerve injury is the ulnar nerve, not the radius. All are true about the lithotomy position, except so initiation of the lithotomy position requires coordinated positioning of the lower extremities by two assistants to avoid torsion. Both legs should be raised one together, not one at a time. They should be both raised together. Lower extremities should be padded to prevent compression, and the classic lithotomy is used for gynecological, rectal, and urological surgeries. Which of the following detects the smallest amount of venous air embolism? Which of the following amount of venous air embolism? Your answer would be changing the precordial Doppler ultrasound signal. So Doppler ultrasound detects the smallest amount of venous air embolism. The low pressure alarm of an anesthetic circuit is broken. Which of the following monitors will provide the earliest indication of a disconnected ventilator hose? So the answer is infrared capnography. So basically, there is an alarm going off, and the earliest indication of disconnected would be this. It so basically the capnography would have been going normally like this, and then after disconnection, it will just be a flat line. So there will be no reading. So no reading will be the first sign before saturation falls, because pulse oximeter and all take about 15 to takes about 15 seconds to detect any fall in saturation, but with infrared capnography it is detected instantly for any fall in ventilation. So basically there will be no reading. So during anesthesia using the Bain circuit, so PaCO2 during anesthesia using Bain circuit, PaCO2 is independent of volume, which is true. If fresh gas flow is greater than 17 ml per kg, or PaCO2 is independent of fresh gas flow if minute volume is greater than 100 ml per kg. PaCO2 may be normal in the presence of rebreathing, but the correct answer is carbon dioxide removal is more efficient during spontaneous ventilation than during controlled ventilation, because the patient can control the carbon dioxide. Which of the following statements concerning monitoring of neuromuscular function during general anesthesia is true? The answer would be, so the amount of neuromuscular block is underestimated if electrodes are placed on the paretic limb. So this is true. So if the electrodes are placed on a paralyzed limb, the amount of neuromuscular block will be underestimated. The principal rationale for the use of warmed, humidified, inspired anesthetic gases in children is to So basically to prevent dehydration. So that's why infants have to be kept warm. To prevent dehydration, warmed, humidified, inspired anesthetic gases is given. The goals of reversal of neuromuscular blockade are all except. So primary goal is to maximize nicotinic transmission, not muscarinic transmission, with a minimum number of nicotinic side effects. So reversal of block should be spontaneous, redistributed, metabolized, excretion from the body, pharmacological reversal, and there should be complete reversal of effects. So cholinesterase inhibitors actually increase the amount of acetylcholine available to compete with non-depolarizing agents. The next question is cholinesterase inhibitors can act at a cholinergic receptor of several other organ systems, causing all except. So all are side effects except bronchodilation. It causes bronchoconstriction. So bradycardia, nausea, vomiting, fecal incontinence, and bronchoconstriction. Cholinesterase inhibitor that crosses the blood-brain barrier is This physostigma crosses the blood-brain barrier. Muscarinic actions are all except the muscarinic actions are all except uh, it causes actually meiosis. So all are true when a reversal agent should be given except the answer is post-tetanic count generally correlates with the time of return of the first switch of TOF. All the following factors influence when a reversal agent should be given except the choice of anticholinesterase administered. All are true about the endotracheal tube except Murphy's eye is used for suction. The Murphy's eye is actually an alternate ventilating port when the main port gets blocked. All are true about eating puff except the normal recommended cuff pressure is 25 to 30 centimeter. Increase in cuff pressure is caused by all except sedation. Oropharyngeal airways are used for all except basically endotracheal intubation. All are true about steroids and cytotoxic drug use in myasthenia gravis except it is used to so it does have effect on the acetyl. It does decrease acetylcholine antibodies and AChR reactivity. All are true with regard to pre-op evaluation of myasthenia gravis except hypokalemia should be hypokalemia as it worsens muscle weakness. All are true with regards to intraoperative evaluation. Test dose of corticosteroids should be given. So that's it guys, that was the mega quiz for today. Hope you all had a good time. Do use my code SASHA to avail your 10% discount. Thank you guys, have a good evening.